Super. Well, more people are joining as we get right to the bottom of the hour. Welcome, everybody. Lovely to have you jump on board for the webinar today. What I'm going to invite you to do, I do want to say too, yes, you are in the right place. Normally, when you come on to the webinars, you see the KD Hub welcome slide. And this time, because we are featuring two presenters from the MHP-IF FAC team, we have a different welcome slide today. So you are in the right place in joining the Hub webinar. Welcome, welcome. I would like to invite people to please, as you're joining, and this is, recognizing that this is a very full webinar with super content that's going to come, and we want to make sure there's some time. Kelly and Andrea in particular really want to make sure there's time for addressing some questions and having some dialogue. So I'm just, as you're joining, I'm going to try to get our mindsets just into this space of thinking about health equity. So what I'm going to invite you to do, instead of putting your name and your project in chat, I'm going to invite you just to please, and I do invite everybody to share at least one entry in chat as you think about health equity. What is one word or one phrase that really comes to mind? So I'm going to both invite and encourage everybody to please use your chat function and just start getting into this mindset about health equity, and with an openness to concepts and health equity practice. And Kelly and Andrea really do have a fantastic webinar plan. So please, thoughts into chat about word association. Essentially, what comes to mind when you think health equity? I'm going to put, let's see. There's one word that comes to mind. So please, a word, a phrase, anything that comes to mind when you think about health equity. Kelly, we were thinking the same thing. As you're joining, please, at least one entry into the chat function. What comes to mind when you think health equity? There we go. Thank you, Louise. Super. Sylvie, Eric, Renata, thank you. What comes to mind when you think health equity? Yeah. Super. All right. We're getting our heads into this topic. It's such a fundamental topic for, the country, for Kelly, your phrase, health for all. And it's also such a central concept related to the Mental Health Promotion Innovation Fund specifically. So it's really terrific timing as well to have this webinar that's focusing on one of the most central concepts within the program and within mental health promotion more broadly. Any other thoughts that come to mind? Word association. There's no right or wrong answer. You think health equity? Boom. What do you think? One word, a phrase, anything that comes to mind. Oh, I have another one. I actually really loved one of Dr. Tam's in her last report. I love the phrase about, or the notion that no one is protected until everyone is protected when talking about the COVID. And I thought, what a brilliant, accessible way of speaking to the notion of health equity. Any other thoughts? Just as you're joining, what comes to mind when you think health equity? Kelly and Andrea are going to tantalize you much, much more on this concept, of course, but this is just our little warm up to get to get us thinking about what we'll be discussing today. Any other thoughts you want to place in chat? Intersectionality, social determinants of health, compassion for all, health in all policies, fantastic, setting priorities, systemic, empowering, awesome. Okay, all right, well, I feel like we're, in the country where we've got heat domes and everything else today. I kind of, maybe it wasn't a great use of language to say getting warmed up. I think we're probably quite warm in our various settings. But truly just warming up to the topic a little bit. And it really is to provide just a bit of a segue to the real main event today. And that is both a presentation and a discussion with Andrea Simpson and Kelly Salmond from the FAC Mental Health Promotion Innovation Fund team. And best of intentions, oh my gosh, I think we're about an hour off from this, but these two, Andrea and Kelly, they're actually, a bit of a spoiler alert, they're actually spotlighted in literally an imminent hub update that's coming out. We just had a slight translation delay, and it means it's going to arrive in your inboxes before end of day, but not before this webinar begins. And so those two are spotlighted, so that will provide a little bit of incentive to go to the hub update and learn a little bit more about Kelly and Andrea. I do want to say that both of them are just passionate and very knowledgeable about health equity and have really embraced and been given the opportunity over the past few years to dig in with some developmental work and help bring sort of health equity concepts and practice into the foreground in the practice of the both the innovation strategy and now the Mental Health Promotion Innovation Fund. And thankfully, I mean, it really is part of bringing the innovation into both of those programs is to really begin to explore these quite central fundamental concepts that are so important for health in this country. So thankfully, Andrea and Kelly have had the runway to invest their time and talents in this work. And I just want to say a big thank you to both of them for leading this webinar, and we'll pass things over to you.
Thank you, Barb. Thank you for that gracious welcome. I'm just going to start on this slide. Today, we're joining to talk about health equity, and thank you to the Hub for creating this platform for us to connect with all of you. And this is a concept that takes its meaning from place, space, and time. So to start, we would like to begin by acknowledging that this work emanated out of Ottawa, the unceded traditional territory of the Algonquin people. Further, in this digital age, we would like to acknowledge the places and spaces in the land upon which this work began and continues. Toronto, where I'm located, is the traditional territory of the Wendat, the Anishinaabe, Haudenosaunee, Métis, and the Mississaugas of the New Credit First Nation. And Andrea is located in Prince Edward Island, all the way on the East Coast, the traditional unceded territory of the Mi'kmaq, the traditional territory of the Mi'kmaq people. Additionally, we invite all of you to take a moment to reflect on the land on which you join and the many nations and people for whom the land is traditional territory and home, and the intentions as we move into the discussion on equity and health in a good way. So with that, next slide, please. Excellent. So this is one of my first, in the age of COVID, big presentations. I'm going to try to stick to my notes to keep this interesting, but I also have on the side here chat going, and we'll try to make this as engaging as we can. So let's start with why are we here? We've all heard the term health equity. It's been widely used in mental health promotion. But that said, the application of this concept can sometimes be unclear. And this is something we struggled with as well as a program. So we're here to try to demystify that concept and create a common language about why and how we understand health equity, and then apply it to our day-to-day work as a program, as well as sharing the tools and resources that we have used in our own work to support a common approach around how we speak about and capture this meaningful work that we do. Next slide, please. If I'm speaking too fast, please put a note up in chat and I will catch it. So by the end of this webinar, we hope to have created first some common understanding around core concepts and approaches to advance health equity that underpin the program Mental Health Promotion Innovation Fund. Second, some familiarity with the resources and tools that exist to support this work at a project level, community level. And third, to give some insight about how the program aims to tell a more robust health equity story. Because as we know, this rich, deep, and meaningful work happens. And we want to be able to tell that story as a program in a way that does it justice and puts equity at the center of mental health promotion in the Canadian context. Next slide, please. So just a quick outline of how we're going to tackle this presentation. The first piece is going to be about creating a common understanding. So we've talked about that a bit already. It includes defining health equity, not as a penultimate definition, but more as a guiding star, and sharing the information that we use and the words that we use to help create that common understanding. Second, in this section, we'll also let you in on some of those core concepts. Some of you even touched on them in the intro chat interactive activity. These support and influence our approach to this work. Second, Andrea will take us through some of the tools to help tell us this story of health equity. And here we will highlight a guide, a placemat, and a tool that can help you translate the work that you do and support the work that you do to really bring health equity to the forefront. These are all things that we have and do use in our work. So it's really about sharing and coming to a common place. Finally, we will then open to a discussion and a Q&A session. We will note that we know projects currently in phase 1 of the Mental Health Promotion Innovation Fund have recently received their invitations to submit a funding request for phase 2. For those questions, please write directly to our MHP-IF inbox. But for all equity-related questions about the work that we are sharing today, please join in, ask, or comment away. We really value this discussion time with all of you. So next slide, please. Okay, what does the term health equity mean to the Mental Health Promotion Innovation Fund? We started off today with a lovely introduction from Barb, including a warm-up around what health equity means. If we go to the chat, we can see many ideas, thoughts, and concepts, all meaningful and all applicable. Intersectionality, compassion for all, no one left behind, setting priorities. These are all a part of that concept. So if we go to the next slide, to add to this, we wanted to offer a short and concise definition that we use to help with our common understanding. Health equity is a policy objective that is evidence-informed and values-based. This is the difference between health inequalities and health equity. It is rooted in values and the moral imperative that those values create to promote equity in health and beyond. Next slide, please. So it refers to the absence of avoidable or remediable differences in health among populations or groups defined socially, economically, geographically. These measurable health differences, these inequalities, arise from underlying levels of social advantage or disadvantage. They show a consistent pattern across the population and are considered to be unfair. That's where that justice and the moral imperative come from. Next slide, please. So this is the graphic that we use. Some of you might have seen this before. We at the Mental Health Promotion Innovation Fund really feel that it captures how we integrate equity work. If you move from left to right on the screen, égalité, equality, is simply the notion of the same for everyone. Équité, equity, includes the context and identifying differing needs for a more equal outcome. And finalement, éliminer les obstacles, removing barriers. This is where we see equity work leading. For the MHP-IF, it leads towards the systems change needed to remove the very barriers that create or contributed to both inequalities and inequities in the first place. Some of the glossaries that we have shared with projects also include a more robust definition that sums this up. It is a health equity approach seeks to reduce inequalities and to improve access to conditions conducive to health by removing barriers for all. Heightened efforts to address the needs of populations at higher risk for poor health outcomes can help reduce health inequities among different population groups. Considerations of equity include addressing race, ethnicity, migration history, sex, gender, sexual orientation, as well as factors as education, income, language, geography, and disability. I will post the French definition in the chat shortly as well. Next slide, please. All of this is to say that the MHP-IF, the Mental Health Promotion Innovation Fund, supports promising and innovative population health interventions that actively seek to remove these structural barriers to health equity through strong partnerships, reflexive practice, learning, knowledge exchange, and ultimately systems change. To give a bit more depth to this, we also wanted to share some core concepts that we really think underpin or focus our approach to health equity promotion, which is deeply intertwined with who we are as a program and what it is that we seek to contribute in the world of mental health promotion. These include, but are not limited to, promoting social innovation, it's right there in our name, the Innovation Fund, addressing structural barriers, integrating intersectionality and intersectional approaches, and prioritizing cultural safety. Next slide, please. So I'm just going to briefly run through these quickly so that we can get to the real meat and potatoes of the conversation today. First, this concept of social innovation. And this comes to us from a report that we had a student with us before my time when we were previously the innovation strategy. Some of you knew this of us, that this was our previous iteration of funding. We were called the innovation strategy. And this component of innovation has kept with us across that 9-year funding cycle and now going into our next 9-year funding cycle, of which we're already a few years in. So for us, social innovation is an initiative, product, process, or program that profoundly changes the basic routines, resources, and authority flows or beliefs of any social system. Successful social innovations challenge and change the very institutions that created the social problem in the first place. Next slide, please. Next core concept, structural barriers. This includes acting on the social determinants, and it means developing strategies to address inequity, which requires the understanding and deciding how to act on the underlying social determinants of health. Sometimes these concepts can become almost siloed in their approach, but as many of us know, these pathways intersect, they merge, and they diverge. And it's important to know exactly where you intend to be in the work of determinants of health. For us, moving upstream means intervening midstream. Here we can influence the environments in which people live, learn, work, and play to acting on upstream social and structural determinants to bring about this systems change that we're talking about. Next slide, please. I saw this one come up in our chat, intersectionality. This is a core concept for us and one that we are actively seeking to integrate into the work that we do. We all live at multiple intersections. For instance, I'm a white cisgendered woman. These are some of the intersections that my identity lives at. Equity work must go beyond what a scholar out of the UK, Graham, calls targeting the disadvantaged, which often names one identity as the place of inequity and embraces that And this idea of intersectionality moves beyond that to embrace that inequity lives at multiple intersections, including race, ethnicity, indigeneity, gender identity, ability and disability, among many, many others. And it is in these various intersections that we have seen the meaningful work that all of our projects continue to do, recognizing that this work happens already beyond targeting the disadvantaged. It lives in the systems and contexts that interact with these intersections and the areas that they overlap in multiple and meaningful ways. Next slide, please. Finally, cultural safety. This work is rooted in the idea that it is up to the systems and organizations to ensure that service environments are safe for all, regardless of culture. We take this concept very centrally to our wider health equity program of work and recognize that it is an ongoing process, and would like to take this moment to note that we are always open to expanding our understanding and applications of cultural safety. With that, I'm going to turn the presentation over to my colleague, Andrea Simpson, who we are very lucky to have with us to share this meaningful work, including resources and tools. I say that we are very lucky because Andrea has been a driving force behind much of this work, including the tools that she will present, which began being shaped by her and a small team in our previous iteration of the innovation strategy way back in 2016. So with that, Andrea, please.
Thank you, Kelly. That's very kind of you to say. It's a delight to be here, and I am very excited actually to see these tools being shared today. So without further ado, we'll launch. Just to say that this second half of the session will look at making health equity more explicit at the design, implementation, and measurement stages of project interventions. So, cette deuxième partie de la session présentera au projet un nombre d'outils pour rendre l'équité en santé plus explicite aux étapes de conception, de mise en œuvre et de mesure des interventions. Ceci dans l'esprit de vous appuyer à rapporter les incidences sur l'équité en santé reliées à votre projet. Next slide, please. So this tool that we're introducing called Toward Health Equity is a tool that aims to integrate equity into population health promotion through 5 concrete steps or elements to consider when developing or adapting an intervention. And so what we have done is pull together in a guide that you can access. We'll provide you with a link. These core concepts and 5 steps that the user is guided to think about and looking at possible ways to address them in their project work. It's intended to be used when an initial assessment of the available evidence shows that a health inequity exists, that is, that systematic differences in risk, protective factors, or rates of illness and injury across the population are present. And a number of guidelines exist to support this type of assessment, such as Progress Plus, and that assessment tool is actually described in this guidance. So you can learn more about it if you don't already. Next slide, please. So I took this snapshot to give you a glimpse of the content. It's this guide, I'll call it, is really designed to be user-friendly and readily applicable to population health projects. The choice of the word steps may be a little misleading. So for today, I'll refer to them as overlapping and iterative steps, not meant to be followed sequentially necessarily, with the possible exception, of course, of the very first step, which is equity objectives. Next slide, please. So this diagram, which we commonly refer to as the placemat, outlines basically in a high level, sort of on one sheet, all of the content that you'll find in the guide. So the first 3 steps that you see in the diagram, equity objectives, social determinants, and mediating factors, have been aligned along the stream continuum and should be read both vertically and horizontally. So the stream analogy is often used in population health to refer to the continuum of health influencing factors through which an intervention aims to bring about change. The terms upstream, midstream, and downstream are in gray colored oblong shapes on the left-hand side of the diagram. And they're meant to frame those first 3 columns that I just spoke of. So this tool was somewhat novel at the time. It is already 6 years old for its use of the term midstream. And I mention this because the midstream is where many of your projects live, or is often the entry point through which you're able to design and articulate the type of change that you seek. So for example, midstream interventions act on environments in which people live, learn, work, and play. So looking at that first column, equity objectives, the central idea is that people occupy different positions within a social hierarchy. We all exist within class structures defined socially, economically, legally, and culturally. So the MHP-IF uses the language of structural determinants of health to describe what are essentially the underlying elements of social, economic, or legal privilege. You will hopefully be able to recognize your work in one or more of the intervention streams, whether structure-based, environment-based, or behavior-based. So projects that intervene at multiple levels or along that stream continuum are more likely to bring about sustainable changes. When we talk about implementing multi-level interventions in the MHP-IF, this is what we mean. And because this takes time, the MHP-IF takes a multi-phased approach to funding. Moving over to the second column, the social determinants, the idea here is that in equity work, we need to be able to distinguish that underlying social advantage or disadvantage. It's not enough to capture differences in health outcomes along the social gradient in order to improve equity, something that Kelly was alluding to earlier. This is around the values-based and moral imperative. So in the MHP-IF, this is what we mean when we talk about identifying interventions that act on the social determinants of health. That third column, mediating factors, is where you as experts in your field define and chart your pathways to change. So mediating factors are intermediate factors through which interventions can positively affect outcomes due to their interaction with the social determinants of health. In the MHP-IF, we refer to moving upstream to mean intervening to address such things as treaty and charter rights, food systems and food security, affordable housing, as well as experiences of discrimination. These require change at structural or systems levels. Columns 4 and 5 in this diagram get into project implementation, looking at such things as engagement, empowerment, and reach. You should recognize some of the wording under column 5, equity targeting, and that's because as a program, we have begun to embed equity practices and measures into our reporting tools, such as the PART. So before we drill down a little more, we would like to propose a quick poll. Next slide, please. So how relatable is this graphic to your project work? I think, yeah, thank you.
So the poll is running right now, and we'll just give it a 30 seconds or so for folks to enter in their responses.
Thank you.
Andrea, you can see the poll as well, can you?
I can, yes.
Great. Okay, looks like the responses have kind of stopped coming in, so I'll show the results briefly.
Okay, thank you. That's helpful.
As you can see, it looks like it's at least relatable in some way, or
Yeah.
very relatable for most.
Glad to see not relatable isn't one of the answers. Great, let's move on then to the next slide, please. So this is a snapshot of what you will find in the guidance for steps 2 and 3. And again, this is just to kind of give you a feel for what the guide contains. And as you'll see, there's an explanation for each of the elements that you just saw in the diagram in this accompanying text. Next slide, please. So unpacking equity work is not straightforward. And part of the impetus for this tool and guidance was to actively spell out the interactions and that mediating factors, and health equity outcomes have by providing a clear vocabulary. So this slide, again, is a snapshot of what you will find in the guide. And in the MHP-IF, when we talk about action on the social determinants of health in order to advance mental health equity, this is what we mean. So mediating factors are the gateways to change. One has to bring about a shift in one or more of these areas in order to create the conditions for improved mental health. So that is what the box that you see in this slide aims to spell out. So for example, when we talk about influencing social, economic, and legal norms, we're wanting to have an influence on, we're wanting to create an impact on the distribution of protections, rights, and benefits in society. When we talk about influencing social inclusion as a structural or systemic determinant, we want to bring about a change around potential to fully participate in society as an enabler of positive mental health. when we talk about mediating in the built environment, we're looking at impacting quality of life as a way to improve mental health. And likewise with family and community, when we look at that as a mediating factor, we're trying to impact the sense of personal security and belonging. So this is hopefully helping to provide some of those bridging concepts, which we thought were missing in the literature, which was also part of the impetus behind this initial work, was to kind of make clear what is that messy middle that most of us work in, and how is it that we can articulate those pathways in a way that we can have discussions, meaningful discussions with partners that may not exist within the realm of public or population health. So creating that common, hopefully, vocabulary and being able to translate that into ways that speak to justice, speak to education, social services, housing, etc. So hopefully this is kind of beginning to make sense. Next slide, please. So just a quick note here that the title or the heading should say Health Equity Indicators Tool. I think I was immersed in the idea of integrating all of these concepts yesterday, so I apologize for that typo. And just ask you to stick with me for just a few minutes longer. I know that I've thrown out a lot of content and we're nearly done, so courage, nous sommes presque à la fin. But I really wanted to have an opportunity to introduce you a little more to this, what I'm calling an updated, new and improved indicator tool. Again, this work began some 6 years ago. So what is this health equity indicator tool? And how does it connect with the other tools and resources that you've heard about so far? So this is a program level tool that we've begun to align with different program measurement and reporting functions, such as the PART. I'd invite you to think of these various tools as cascading or nested tools. So each one is meant to drill a little further into the details. They each occupy a slightly different space. Some are more conceptual, some are more practice oriented, and this one is more measurement reporting focused. But the processes and themes and major elements all remain the same. So the purpose of the Health Equity Indicator tool is to build our capacity as a federal program to report on that rich, meaningful work that you're doing on health equity impacts, in part via the projects that we fund. So as I mentioned just earlier, we have begun to embed some of this content into reporting tools. And this particular tool is also an appendix or part of the background documents for those of you who are have been asked or invited to apply for our phase 2 funding. You will find this in the background document for that application. The tool can be used in one of two ways. It can be used to identify components of your project that address health equity as well as possible gaps. And it can also be used to strengthen your capacity to integrate, monitor, and assess impacts on health equity. So this excerpt addresses how to measure whether an intervention or a project aims to influence the underlying factors that contribute to health inequalities. The second column provides guidance on what that looks like from an implementation perspective. So for instance, when we ask you to have a social determinants of health focus, what might that look like? Key factors contributing to the health inequalities have been identified. Baseline data are collected to address gaps related to those contributing factors. The intervention level or scope is consistent with the key factors that it aims to influence. And research or knowledge development is consistent with the key factors it aims to influence. So there's a kind of thread there that runs through, and that hopefully, again, provides you with some guidance on how to embed equity into your design and adaptation of interventions. And finally, that third column is really where we're moving into new territory by looking at what that means from a measurement perspective. And again, all of this was drawn from the literature, that what we identified as the best or most promising practice literature out there at the time, and has been refreshed in the last 6 months to reflect the learnings from phase 1 and from the innovation strategy. So we feel it's a more robust tool than it was even a year ago. And we're excited to share it with you because we really would love to know if it works for you, if it speaks to you, and ways that we might fine tune. So this is definitely a work in progress, and is something that we would be very interested to even workshop with you at a later date. So that is the end of sort of the formal or substantive content piece of our presentation today, and we really wanted to leave time for a discussion and a Q&A. So we're happy to open things up and hope that we've sort of stimulated a bit of your thinking. Before we do that, we just have one final poll, or two actually. Next slide, please. Yes, so how interested would you be in a workshop to further delve into some of these project level tools?
All right, I'll share these results. Yeah, as you can see, quite a bit of interest once again.
That's great. Glad to know. Well, that's heartening, and that gives us a pretty good indication. Thank you. So there's just a follow-up poll to that about the timing. So what timing would be most convenient to workshop these tools? And you can select all that apply.
Okay, just a couple more responses coming in. We'll give it 10 seconds. All right, here we go.
Great. So it looks like September and October are the most convenient. Thank you. So yeah, we're glad to move into the next slide, just the Q&A and discussion portion of this meeting, this presentation and webinar.
If anybody has some questions, please feel free to unmute yourselves or ask in chat, whatever. We've now got most of you on the screen. We can flip-flop a little bit, but please feel free to unmute yourselves and ask away. Any questions for Andrea and Kelly?
I'm going to quickly jump in and just start. Andrea, do we have a public link for the guidance document that we can share? And maybe we can shoot that over to the hub as well.
Yep.
Yes, for sure. Yes, thank you for that prompt. So we can provide those links right after the webinar. They are publication, Government of Canada publications.
Yeah, that's terrific. And actually, just so everybody knows as well, they will be shared by email, but then we will also host those on the in the annotated resources section at the Hub website.
Thank you. Perfect.
Any thoughts, comments, feedback, critique? We're also very open to that. Thoughts for next steps?
So maybe I'll make a comment. It's Claire Bedker here. I'm the Scientific Director for the National Collaborating Center for Determinants of Health. And so I heard the sort of last half of your presentation, so I apologize for being a bit late. But I want to make a comment, and this is not easy work, so congratulations on doing this. And the proof's going to be in the pudding, right? So I think what you need is folks to actually ask their questions, step up here and test this, because that's where you're going to see whether you can actually shift that and upstream, right? And really shift so that you really do consider, or that we all together consider, what those avenues to real change are. And we're in a beautiful, I think, time in your development, but also in our history here, where we can really make some substantive changes together to promote and advance health equity. But it does require frameworks, cues, prompts, indicators, things that we can and should and will hold ourselves accountable to. So I'm excited about the work that you've done, and hopeful that put it on the ground and test it out and see how it goes.
Thank you, Claire. Any responses to Claire's comments? I think it's really helpful, Claire, to have that sort of broader perspective on, health equity from, a Canadian perspective, and certainly the MHP-IF nested within that. Not easy work, but also so much to learn about even the intersection of the downstream, midstream, upstream approaches as well. We've got so much to learn about how to translate the concepts into practice. And that's really an important niche of the MHP-IF as well, is that how do you actually do it? And that's actually what the program is really trying to do, is translate concepts into practice, and, everybody being pioneers within this. Kelly.
To that point, what I would really like to say is, a lot of this work comes from the innovation strategy, which some of you are familiar with and some of you aren't. And the gaps that we saw when we were trying to talk about equity. And those gaps are ours as a program. Our projects, the projects that we fund, the amazing work that's happening on the ground, these things are almost innate to the way that the work happens, and we recognize that. So this is really about creating that common language as well, so that we can talk about that work, so that we can understand it and we can showcase it. Because I think, you know, this is one of the things that we learned in the innovation strategy, is that all of the projects, every community-based organization understands this work, this equity work. And it's really just coming to the table and trying to make, as Andrea often tells us, the implicit explicit, so that we can have those conversations and move those forward. So I just wanted to add that. Thank you, Claire. That was an excellent comment. I totally agree.
Hi, I just wanted to add, if you can all hear me. Yeah, I just wanted to add that as you were doing the presentation and explaining the new tool and everything, I kind of was looking at it, and while I was looking at it and listening to you speak, it was kind of like a web was being created through my mind, like, oh my God, I can do it, I can do this, I can do that, we can do this, we can do that. And I just think it's like, it's really an excellent tool, and I really am looking forward to learning more about it, and because it's really universal, I think, in its approach, and I appreciate that very much. Thank you.
Thank you so much for that feedback, Lisa, because it was a labor of love, and it really was something we tried so hard. There were so many ways that we looked at approaching this and wanting to make it, you know, universal, something people could identify with, no matter where they are. If you're doing equity work, hopefully it lives in somewhere in this diagram. So I'm really, really pleased to hear you say that. And I welcome the opportunity, you know, to work with you. Like, I think what we would like to see is people reach out and also have a series maybe of workshopping sessions where people get to kind of play out their own project work and really test it with these tools, and where we can do that together. So I'm excited to hear your comment. Thank you.
Kelly or Andrea, did either one of you want to respond to, oh, okay, there you go. Kelly, you're on it in the chat. Do you want to speak to that, Kelly?
Sure. So Tavia asked, will there be opportunities in future MHP-IF funding streams to include supports for project budgets to ensure equity for program participants, even if they don't seem obvious, directly tied to the program objectives? Yeah, I mean, this one's such a tough one, right? Because I don't want to like presuppose a yes answer on anything to do with budgets. I'm going to leave that to the management. But what I will say is the way that we conceptualize this is that equity work lives in all of the health promotion work that we do. Promoting equity is a central tenet of promoting mental health and promoting mental health. So yes, we see this work as living in every project, and we aim to be able to not only support that, but also support the conversation that comes out of it and the systems change and the move upward that comes out of those pieces. So short answer, yes.
Seems that was very well received.
I might add to this, you know, sometimes the term health equity can be such this big and daunting, especially when you have funders like us, and we're very aware of our position as funders. And that's partly why the KD&E Hub is here, to allow for you know, better dynamics, because we're really aware. So when we come out with these terms, health equity, yes, they can be very big. And we tend to tackle them in that very big way, but they can also be in the detail. We have projects that include pieces of health equity by, you know, giving taxi chits to youth that won't be able to to have transport to where they're going, to support that, you know, approach to getting over that barrier before we can do that meaningful work around systems change, because sometimes that's just where the equity work lives. And oftentimes equity work lives at multiple levels in your projects and your programming and your interactions. And we recognize that. And it is so robust that we also recognize we won't be able to capture all of it, but we want to be able to tell these meaningful stories in a good way.
I should perhaps also mention, just to further pique your interest, that there is a project level tool that has been created in draft that mirrors the placemat, the program level placemat that I shared with you, which we're very excited to pilot in a very sort of informal way with interventions, with projects. And so we're just getting to the final design stages of that, but we hope that this additional tool will further make this a reality, a kind of a very accessible and usable sort of package, let's say, that you will want to quickly apply when you see it. So we're really quite delighted that we have this additional piece coming soon, which is why we asked you about whether you'd be interested in further workshopping and looking at these things. So they are a package. They come as a sort of, they're all meant to speak to each other. And we have one more thing that we feel will be most relevant to you as projects.
Thank you, Andrea. Any other comments or questions?
I see some comments in the chat here about being able to see the draft and work with it through
Everybody's
us. So,
just getting ready for a day off.
exactly, but yeah, as Andrea was saying, that is certainly an intention to make sure that you know, we can walk alongside each other as we're putting together this program or project level draft as well. So we will try to use the hub to send out that information as we go and where there's opportunities to connect on it.
Perfect. All right. All right. You know, this is such a nice expression of the MHP-IF community that, you know, the three sort of main players within it being the Public Health Agency, MHP-IF team, the projects, and the hub with extended family members with the Hub Resource Collaborative, et cetera. And of course, the topic is so highly relevant to others, and something that the hub does as well is bring some of these resources and intel to others and engage with a larger group as appropriate without taking the spotlight off of the project. So things like our annual symposium. So I just want to say, you know, kudos to all three players for this type of very tangible expression of the MHP-IF community. I think we've heard very briefly, I mean, Claire, back to your point about the not easy work. I think this webinar, A, reinforces that, B, speaks to the kind of thoughtful, deep planning process that does need to be unpacked to move from what are you really trying to accomplish in the first place to understanding some of the entry or leverage points for achieving those health equity goals, and then some very practical tools. I mean, you know, the very tangible expressions, be it taxi chits or otherwise, that, you know, help to accomplish those bigger, broader goals. So that's really what the intention was today. Is, I mean, we always have to go from concepts to tangible, on the ground, moment by moment practice. So I think Kelly and Andrea, kudos to you for thinking that through and bringing this type of tool. I think that the common language point about health equity and also, quite frankly, about mental health promotion more broadly is something that the MHP-IF is really contributing to as well. So again, really on sort of the cutting, the sort of really on the leading edge of kind of the big concepts, and let's keep putting the innovation into the Mental Health Promotion Innovation Fund and figure out sort of, how to do this both individually as individual projects, but also as a collective community as it makes sense. So Kelly, Andrea, is there anything more that you would like to say in closing? There's a lot of comments coming in chat, just lots of thank yous for your excellent presentation and discussion. So any closing remarks from either of you?
Just that it's really an exciting time for us, and we are looking forward to the continuing conversations. I know some people have commented that they just need time with the material, and that is totally fair. And I think once we give you that time, we'll be ready to have a follow-up, a round 2. So stay tuned.
Okay. All right. Well, thank you, everybody, and enjoy whatever time away from offices you get over this start to July. And look at your inboxes either later today or early next week. You will have the most recent version of the Hub update. So thanks to all. Bye for now.